We're going to do the musculoskeletal portion of the physical exam. The very first thing to do, of course, is to inspect the patients, especially if they have any kind of complaint, to focus on that area, but even just in general, to look at the patient's overall symmetry, any kind of lesions that you might see, asymmetry that might indicate fracture or dislocation. So just looking at overall the patient, making sure that everything looks symmetrical and without lesion. The very next thing you want to do is ascertain the patient's range of motion. The best way to start off is the active. So can you please raise your hands above your head as far as they can go and come back down. Wonderful. And cross the midline for me, please. Wonderful. Now can you please raise your leg up as far as you can go and come back down. And the same thing on this side, please. Wonderful. Active range of motion, of course, is normal in upper and lower extremity. So we don't really need to do passive, but if there was some abnormality in active, then we will have to go to passive. And so one way to do for passive range of motion is to stabilize the actual shoulder joint, raise the arm up, and see if there's 100% range of motion, and there appears to be on the right hand side. And do the same on the left. Wonderful. And you can repeat the same thing as well on the lower extremity with the knee joints specifically. Here. And there appears to be 100% range of motion, passive range of motion upper and lower extremity. The very next thing we would do is neurovascular exam, but please refer both to the neuro exam and the cardio exam for them specifically. When it comes to DTR, muscle strength and sensation, it's the neuro exam, and pulses to the cardio exam. The very last one is palpation. Naturally, the patient comes in with a complaint of a shoulder joint or elbow joint pain. You will palpate that joint very thoroughly. So if the patient were to have a elbow complaint on the left-hand side, you want to make sure you palpate the entire joint quite thoroughly. Making sure you get both the medial and the lateral epicondyles, the aponeuroses, the acromion, the olecranon on the back. Making sure you palpate everything, making sure anything kind of tenderness, and look, of course, the patient's face to help you ascertain if there is any kind of tenderness there. But just in a general exam, it would be best to go on the back of the patient and just to see if you can please face the wall in that direction. And just ascertain any kind of heart changes in the patient's paravertebral musculature. So just please let me know if anything feels tender, okay? So I'm just palpating along the paravertebral musculature, trying to see any kind of boggedness, any kind of asymmetry, any kind of tenderness, of course, and any kind of just restriction that I can see based on just my palpation here. Everything appears to be normal. Thank you.